Question. You have seen the price of healthcare rise, and I know it's a huge subject. I know you can't answer all the things, but maybe you can give a ballpark on this. Why do costs go up? What is the cause of that?
Well, that's a very good question, and it's complicated.
Yeah,
and there are many factors.
Yeah.
From the time I started or graduated from Harvard Medical School in 1965, the technology has exploded. We can do things now that we never even dreamed about in 1965 or 1970, my training. So the technology is one reason. Imaging tools, radiology instruments, MRs and CAT scans and so forth, are widely used today. However, let's talk about appendicitis. When I first started, we didn't have any of these tools. We had to make a diagnosis on physical exam and history, and we kept track of how often we were wrong. And the going rate was considered, a good rate was 90%. 90% of the people with abdominal pain that we thought had appendicitis and we operated on had appendix. Now it's pretty much close to 100% with CAT scans or ultrasounds. However, everybody now with abdominal pain gets these tests, which can run up a bill of $2,000. The doctors today aren't trained in physical examination like they used to. They just rely on what the radiologist says. And I can tell you sometimes the radiologists are wrong because they don't examine the patient either. They just do the CAT scan. So technology is a big reason for cost. Another reason is specialization. Specialization's been good. But an example that I think tells a big story is I was trained in hand surgery, hand trauma, common upper extremity pain syndromes. When I came to Plymouth in 1972, the orthopedic docs didn't want to take care of it. They liked their big bones and big joints. There wasn't anybody to do it. So I enjoyed doing it, and I did all the hand trauma. I was the only surgeon that did it for many years. And after doing it for about 15 years, in 1985 I think it was, I found that the HMOs, the insurances were not listing me as a hand surgeon. Well, it turns out the powers that be, somewhere around 1974 or 5, that's after I finished my residency training, decided there would be a hand surgery specialty, and there would be an examination you had to take. So in 1985, after doing it for close to 15 years, I'd done a lot of hand trauma. I'd gone to many symposiums and so forth. I'd even developed a rat lab to do microsurgery, learn the technique of microsurgery, which helped me with hands and my vascular surgery. So I called the American Board of Surgery, which is the body that credentials, and I said, I'd like to sit for the exam. And they said, well, do you do rheumatoid? No. Do you do pediatric congenital? No. Do you do reimplantations? No. Do you do sarcomas? No. I said, those are true specialties that need to be done in Boston. But we see a lot of hand trauma in our emergency room, common garden variety hand trauma. I said, I'd like to take the exam so I can be listed. No, you can't, he said. I said, don't you realize that nobody will be there to take care of these people? Aren't you interested in the care of the patient? No. Well, they didn't say it exactly that way. But that was what happened.
Underlying reason.
So now, I mean, if I had kowtowed and not done hand surgery, that would have made it worse for the town of Plymouth. And that's what specialization has done. It's fragmented healthcare. It's decreased the accessibility and increased the cost. Medical students can see that. They want to go into specialties.
Right. I talked, because we have other physicians here. We have another physician here that's just a regular family doctor. Oh, my goodness, there are so few doctors interested in just family practice anymore. It's
Yes.
become more and more an issue.
They work hard, and they don't earn as much money. And unfortunately, as we talked a little earlier, money makes a big difference in the way we behave, we humans behave.
Yeah. Another cost factor you had mentioned in our pre-talk was pharmaceuticals.
That's right.
Yeah. What have you seen with that over the years?
Well, there's been some recent, really very amazing things happened, and I wanted to be accurate with this. Treatment of hepatitis C. A major problem. 50% of people with hepatitis C were dying. A lot of people in jails, drugs, hepatitis C. Salvati was a new drug, and it was one of these miracle drugs. Now, I think the mortality rate is less than 5%. But the cost of the drug is $84,000 for cure. In India, it's only $300. EpiPen is another one. EpiPen is used for allergic reactions. It can be a life-saving drug. The company that makes it did a little change to it and went from $50 to $4,500. Mylan. They raised the price to $4,500.
Right. We're all aware with that.
You are.
Major news here.
And public shame got it down,
Right.
but it's still too expensive. And that's a problem because school nurses, and parents keep it, and that's out of their range. Another one is Narcan, which is used to save people with addicts with overdoses. There used to be $1 for a dose. Again, it went up to $4,500. Kaleo, the maker, increased it from $690 several years ago, $690 to $4,500. And that's now it's approved for use for medics, EMTs, paramedics, and it's saved lives. And it turns out that Congress will not negotiate. It does not allow the Centers for Medicare, Medicaid to negotiate with drug companies. But they allow the VA system to do that. Now, what does that mean? That means that whatever the drug companies want, they're going to get, because they don't allow them to negotiate. Now, I ask you, what do you think the reason is that Congress is behaving in this way?
The first thing I could think of, just as an average Joe human being citizen, it's probably connected to reelection campaigns. It's my guess. I could be wrong.
Well, I tend to think it's the money they get from the drug companies.
Yeah, they kick into their campaign.
Yes.
Yeah. So it's not legally a kickback, but they're getting preferential treatment because their campaign is being supported with monies.
That's right. And I think it's important that people know this, that the common Joe knows what's going on, what Congress is doing. I think it's wrong.
So you've been talking about different ways the medical costs have gone up through pharmaceuticals, through physicians becoming specialists, and technology that has helped it. Clearly, there needs to be something done about medical treatment in these United States. There is Obamacare or the Affordable Health Care Act. There have been other things, but there are a number of doctors now who would like to see a new system proposed in the United States, right?
That's right.
So why don't you share that with us?
Well, a recent poll shows that close to 60% of doctors are definitely in favor of this. And I suspect more are, but this in the poll have shown that.
And what are they in favor of?
Okay, it's what actually Bernie Sanders was talking about. It's a single payer, that is the government, and it's improved Medicare for all.
Okay, so it takes the standard Medicare that most senior citizens use, right?
That's right.
And opening it up to everyone.
Everyone.
Okay,
The old phrase is everybody in, nobody out.
right.
And in effect, you have a card, Medicare card. You go into the provider, you hand it, and that takes care of everything.
Yeah.
It removes the slicing and dicing that private insurers do. Oh, you can't do this. You can't do that. Medicare and Medicaid never once told me that I couldn't do a test or a procedure. But the private insurance company doctors tried to, administrators who thought they knew more than I did. They were meddlesome. They were interfering, etc. So there's a huge waste.
And you had some facts and figures
Yes.
about this. So.
Yes. But this improved Medicare for all also takes care of dental bills as well as medical bills and long-term care. That's all figured in. And the system will cost less than the present system. Now, Steffi Wohlhandler and David Himmelstein came out with a report published today in Annals of Internal Medicine. And basically, and to put it simply, they said if we go to that system, we would save $1,062 million because of, and they listed it, $500 billion will be saved because healthcare paperwork and profits will be reduced significantly. $220 billion reduced because there will be no insurance overhead. $150 billion will be saved because of making hospital billing and administration easier. $75 billion will be saved because making physician paperwork and billing easier. $113 billion will be saved because it allows the Center for Medicare and Medicaid to negotiate with pharmaceutical and medical device makers. And with only one payer, they're going to have to come up and be more reasonable than they've shown in the past. So that's a lot of money, and it turns out the total healthcare spending per year is $3 trillion. This saves $1 trillion, which allows us to take care of everyone. And the fact is, if you look at Canada or European developed countries that allow treatment for everyone, their cost is half of what it is for us.
And the big argument I hear all the time is, but our country is so large. Do you think that is a valued argument?
I don't see how that would affect it.
Yeah.
I think we have infrastructure now to take care of this. And it would put, I think, more value in private practices without the requirement to pay for administration. And people will be, and doctors will enjoy the practice of medicine far more. I was a solo practitioner. I really don't think I would have been a doctor if I had to work for some of these big corporations where I couldn't tell a patient, oh, don't worry, I'll take care of you. I'd have to send them to some clerk, and they would make out some payment schedule or actually refuse to take care of the person. It changes the whole practice, and it's wrong. Mm-hmm. So we can change it. And another thing that's interesting is it would preserve the good parts of Obamacare, the parts that allow us to families to take care of children until age 26, that removes any cap from total life spending for health care, that takes care of sick people, chronic illnesses, And it would answer some of the Republican complaints about Obamacare. Obamacare is a good target for complaints. There are problems with Obamacare. So it would make the Republicans happy and the Democrats happy. I don't know why they're not talking about it. I stress, this is not government-run health care. As I told you, I had more problems, far more problems with the private health insurers than I did with Medicare and Medicaid. I always got paid. If I filled out the form right, I'd get paid. Many times I had to get into an argument with private insurers, and sometimes they wouldn't pay for no reason at all. They had, as the old rule says, he who has the goal makes the rules, and they used that. They made the rules.
And they have the goal.
And they have the goal.
And doctors, I think, who are caught up in this system, I think it probably just takes their morale and shoves it into the ground.
Oh, definitely.
I still bet that when doctors graduate from medical school, no matter where they go to school, they're just chomping at the bit to help people and heal them and work with them and
yes,
give them their life back from illness. I'm sure that's still a major dream of healthcare professionals, yes?
Yes.
Yeah, even the youngins today?
Oh, they're all, boy, the young people that go into medical school are idealists. And I love the white coat ceremonies that they have when they graduate and go to be an intern. There's this traditional white coat ceremony. And it's just wonderful to watch their expressions. They're all full of excitement. But something happens in the residency training system. And that has to do with the corruption of turf issues with specialization. That was documented, actually, in one of the Harvard magazines by a cardiologist from Bangor, Maine, who had graduated from Harvard Medical School. He decided to take a sabbatical, and he went down and he paraded as an ultrasound technician. Nobody knew he was a cardiologist. And so he would just made observations on the training of residents in Boston. And he made a report that was published by the dean of Harvard Medical School, who wasn't particularly happy with the way his students were being treated or educated. And that's another issue, of education of physicians. But the turf issues were making it difficult. And a lot of residents, cardiology residents, were depressed, dropping out. And this was supposed to be the mecca of medicine in the United States.
Which is a whole nother subject.
That's right. You're right. We could go on, Anthony.
I know, you could. But I wanted to say just briefly before we end this today that I know that you have told me stories about ways in which you have helped low-income workers at the hospitals that maybe were paid minimum wage working in the cafeterias. You have figured out ways to give them surgery.
Oh, yes.
When you were working. And I can only say that's because you're a good old Episcopalian. Respect the dignity of every human being. And
well,
that's the first
Anthony,
thing I thought of.
There is one thing that I really think is important. There was this gentleman from the University of Michigan who spent most of his life trying to figure out quality, how to measure quality of healthcare. That was his thing. He published many articles, and he was quoted by Institute of Medicine, became very famous. He died in 2005, and last July, a summary of his work and his story was an article was published in the New England Journal of Medicine. And his name is a hard one for me to pronounce. It's an Armenian name. Avidis Donabedian. Avedis Donabedian. And he was was quoted in the last paragraph of that article, summarizing, this was before he died, summarizing his work, what he said. And he said, a physician needs to love his profession, his patients, and his God. A physician needs to love his profession, his patients, and his God. That's his summary of all his work on trying to figure out how to measure quality of health care, which of course you read in the newspaper every day, high quality health care. It's very difficult to measure. And that's why we don't really have a free market system. People talk about it, but it's not a free, people don't know. They go to a doc for reasons because they care. The doctor shows caring. Mm-hmm. So it refutes the idea that we have a free market healthcare system. Not like buying television sets. Television sets are easy to evaluate. A doctor, a hospital is very difficult.
Mm-hmm. Well, thank you so much for sharing with us today. And I hope people can look at this issue of, what is it called again? Single payer.
Improved Medicare for all.
Medicare for all would be the
for everyone.
Yeah.
That's right. Everyone.
Yeah, Medicare for everyone, and maybe that's a possibility. It's something to think about.
It is, but it's not only a possibility, it's the right thing to do, and it's the only way to solve the problems that the Democrats and the Republicans have.
Thank you.